When a loved one needs specialized care, finding the right private duty nurse can feel overwhelming. Hiring a private duty nurse and knowing the questions you need to ask can make all the difference between standard care and exceptional private nursing care at home that truly addresses your family's unique needs. Hi, I'm Jasmine Bhatti, registered nurse and founder and CEO of Navi Nurses. From my experience as a registered nurse, I've seen firsthand how the right private duty nurse transforms recovery outcomes. Today, I'll share these essential questions to ask when seeking private nursing care at home that will help you find the exceptional care tailored to your family's specific situation. Private nursing care at home isn't just about having someone present. It's about finding a professional who will honor your loved one's dignity while delivering expert nursing care. Knowing how to hire a private duty nurse who's truly exceptional begins with clarity about your specific needs. Are you seeking post surgical support, chronic condition management, or transitional care? For complex medical conditions, consider seeking a private duty registered nurse specifically, as their advanced training allows them to handle more complex care needs, recognize subtle changes in condition, and communicate effectively with doctors and the medical team. These are benefits you won't get with lesser trained caregivers. Essential questions that you should be asking when hiring a private duty nurse includes first and foremost, what nursing licensure do you hold, and is it current and unrestricted in this state? So you want to find out, are they an RN, an LPN, a CNA? Then ask, what specialty certifications do you have, if any? You'll also want to ask, how long have you been in practice for? We know that nurses who've been in practice for more than a few years are able to provide comprehensive expert care, and their ability to catch problems is a lot more focused and quicker than a nurse who's newer to practice. Another thoughtful question that's important to ask is, are you currently practicing in a hospital setting? This will help you understand if they're up to date on the current evidence-based practice that's being utilized in hospitals. It's something I know I look for in someone that I would want caring for my own loved one. You also want to ask these nurses about continuing education. Are they staying up to date on the relevant care that's important and critical to the condition of your loved one that you're looking for? And you'll also want to get to know if that nurse has cared for someone with similar conditions that mirror what you are looking for to care for yourself or your loved one. At Navi Nurses, we exclusively work with private duty registered nurses who have 4 or more years of experience in the hospital, with many still maintaining their hospital positions to keep them current on their skill sets and the latest medical practices. Other things that are important to check on: background checks, their proof of professional liability insurance. You'll also want to know if the nurse has their immunizations and if they are tested for TB. If they're going to be driving you around, asking about a clean driving record and asking for prior employment experiences and references are important. Questions related to the care that would be important to ask are, what happens if my nurse is unavailable? Is overnight or 24/7 care available if our needs change? How do you handle communication with family members and doctors? And what's your process for creating personalized care plans? Quality private nursing care at home depends on reliability and flexibility. A comprehensive home care provider should have enough specialized nurses to ensure backup options as your needs evolve. Questions related to just the practical everyday arrangements include, what is the hourly rate, and are there additional fees like overnights and weekends? Is there a minimum scheduling requirement, or does insurance cover this care? Figuring out how to hire a private duty nurse within your budget requires direct conversations about costs. Since private duty nurses vary in cost based on their credentials and location, specialty, a private duty registered nurse typically commands higher rates due to their advanced training and ability to manage complex situations. This investment often pays off, though, through fewer complications and reduced hospital readmissions. At Navi Nurses, we believe the advanced training of registered nurses provides exceptional value that far exceed the cost difference. The most revealing questions when seeking private nursing care at home focus on care philosophy. One advantage of working with a private duty registered nurse is their clinical judgment and ability to spot potential complications before they become emergencies. Their extensive training and experience enables them to view clients holistically, seeing beyond medical tasks to address emotional well-being and quality of life while maintaining the clinical expertise to manage complex situations. If you're looking for case-specific care abilities, an important question to ask would be, what's your approach to X type of care or recovery? Or how would you handle this sort of scenario? For example, if you know your parent will refuse their medication, ask ahead of time. How would you manage my mom or dad if they are refusing their medications? Their answer will reveal their approach to patient dignity and communication skills more than simply asking about medication management experience. You can also ask about documentation and communication. How are they documenting what they're doing, and how are they communicating that back to you and the rest of the family? From a personal side, you'll want to get to know your nurse as a human, so go ahead and ask them, why did you become a nurse? What do you find rewarding about being a nurse? And why do you choose to remain in practice and come into people's homes and not just work in a hospital? You'll want to learn more about their interest outside of nursing. Maybe there's a way for you to connect. Maybe you both like yoga or hiking, or you find that you both like cats. Since private duty nurses work in intimate home settings, compatibility like this matters tremendously. Ask what they find rewarding about nursing and observe how they interact with you and your loved ones during the initial meeting. Hiring a private duty nurse is ultimately about finding someone with the perfect blend of clinical expertise and personal warmth and compassion. For situations requiring complex medical management, a private duty registered nurse's assessment skills and clinical judgment may be the best fit to ensure your loved one's recovery and peace of mind. Throughout Phoenix, Scottsdale, and Paradise Valley, families are discovering how the private duty registered nurses from Navi Nurses elevate the recovery and health experience with their advanced clinical skills and compassionate care. Don't navigate important decisions and situations alone. Visit navinurses.com to schedule a consultation where we can discuss your specific needs and help you find the right private duty nurse for your family's unique situation. If you found this information helpful, please like this video and subscribe to our channel for more guidance on healthcare decisions. And don't forget to ring the notification bell to stay updated on our latest resources for navigating care options.